Grand Rising family, and good day. Hope all is going well on your side of the screen. I just wanted to talk really quick and just bring it up because I see that not that many people are speaking on this subject. But I wanted to talk about this whole thing with the ventilators and Medicare. Again, with all the information and cross information and the informations from the so called experts, okay, that are just the people that are hired to give you the version or use the terminology to get you to see things the way that they would like you to see them during this pandemic. Okay, so again, you guys know that we're against the grain on this channel, and so I am just simply pointing out the way that I'm seeing things, and I think a lot of other people are seeing it this way. So it may not be what you're hearing on your mainstream mass media, but again, it's something to think about. Okay, so I don't know. This is talking about fact check on USA Today, and it says that it says fact check: hospitals get paid more if patients listed as uh, COVID-19 on ventilators. Okay, so this is from um, April 24th or something. Okay, 27th possibly. There's a video attached, but we're not going to be looking into that. We're just basically going to be reading this here article. So it says the claim, okay, which happens to be more than likely what it is. Hospitals get paid more if patients are listed as COVID-19 and on ventilators. Senator Scott Jensen, a physician in Minnesota, was interviewed by the Ingram Angle. I don't know what that is. Host Laura Ingram on April 8th on Fox News and claimed hospitals get paid more if Medicare. Okay, so again, a lot of things we're starting to see is free testing. If this is the truth or not, again, you have to use your own discernment and do your own research when it comes to any of this, um, and see how you see it. Okay, because again, just because the mass media is sharing it with you does not mean it's true. Just because they say that these are specialists, it's not really true. I doubt that anyone goes further except for a truther or someone that chooses to again go against the grain and question things. Okay, not just take them and repeat them like parrots. Okay, um, again, when we're talking about Medicare, I'm thinking that we're talking about like Medicaid or something, would be for low income, poverty stricken, or low income, um, more than likely so called minority, okay, peoples. Okay, poor white, black, brown people. Okay, elders. Okay, so again, this is if Medicare patients are listed as having COVID-19 and get 3 times as much money if they need a ventilator. Now, um, this is very important because again, first of all, this is supposedly started off because I think Medicare is for elderly. This started off being something that was going to affect mostly elderly people. There's a lot of people that have had discrepancies when they have their loved ones in care of others, okay, during this time. Um, and I think that is kind of sad because a lot of these places, such as places in New York, are getting rid of people's bodies that are not claimed. And again, remember, we can't have funeral services at this point in time, which you can grab a burger from McDonald's, okay? That, again, some of these places, if you deal with the people, not all of them, that are in these facilities, you know that they don't follow protocol in anyhow, but then you think that it's still safe because they are allowed to stay open and seen as essential. Okay, that they're somehow cleaner and you're maybe not going to get COVID with the millions of transactions a day and all the different people that are handling food and money in these places. Okay, so again, um, They already get more if it's COVID. We already realize that we have been told directly or indirectly by some of these platforms, okay, again, whether it's true or not, you'd have to use your own discernment, that um, they don't have enough machines, and that to go around, and that oh, what was my point? They are marking down COVID-19 on death certificates, even if the people have passed away from something else. If they've had it or have it, or if this marker, and again, we don't even know exactly what this COVID is. We know what they're telling us is. For all we know, it's something that they've already passed around through chemtrails or some other type of the water system, or this could be anything, right? Because again, they've never seen it like this. Again, they're calling it a flu. That's fine. I'm not a scientist or a doctor, but I know how these people work that are involved in this pandemic and the fear mongering that's going on. Okay. So again, we don't know. They're saying more than likely everybody has it, okay? Or 50% of the population has already had it, right? Okay. So anyhow, keep that in mind, that when people die of other causes, they're still putting COVID, and there have been doctors that have stepped down, or been let go because they don't agree with this, okay? And that's not the way they usually do these things, okay? Again, we don't do it when 80,000 people last year died of the regular flu. Okay, so again, and I think there's a 98% recovery rate with this particular flu. Okay, so the claim was published April 9th by The Spectator, a conservative publication. WorldNet, whoever, shared it April 10th, and according to Snopes, a related meme was shared on social media in mid-April. Again, they're watching everything we do and whatever we do and say, and they catch on that this is something that is actually catching on, and people are actually looking into it. They'll start to then rearrange what they're saying on the news to kind of boot it to the side, or to kind of, oh, people are saying that this and this and that, but that's not the case. So to reiterate, or to get you to jump back on board, or place some type of fear onto it, so that you can go back to what they're telling you, because you really don't know, because you're not a scientist, you're not in the lab, you don't know what any of this stuff is saying. We just know that these are people that they've chosen. There's other doctors and people in the industry that do not agree with this. They do not think COVID is doing this. They do think that people are dying from regular things, and we're writing down COVID on the birth certificates. Okay. So again, if I'm trying to convince you or sell you on something, like our governing forces and the media always do, okay, or manipulate the masses, okay, manipulate, okay, then this is what I would do. I personally wouldn't, but I'm just saying, if I were these people, okay, because sometimes you have to put your mind frame and use it in a direction as to what the people that are trying to convince you and how they're thinking, okay. So Jansen took it to his own Facebook on April 15th, saying in part, how can anyone not believe that that increasing the number of COVID-19 deaths may create an avenue for states to receive a larger portion of federal dollars. Now, things like this have already been going on, that when you have these things like Medicaid or Medicare, that, a lot of times people, I think it was happening with dentists a while back, pulling more teeth and telling people they have more issues with their mouth so that they can get more compensation. So this is nothing new. Things are dirty in the medical field and industry as well. It's all a business. And when you go to the top of the pyramid, when it comes to any business or model, make, or format, okay, there's always those at the top that know exactly what's going on. And then the orders are given from there down to the administrators and things like this, and then down to the regular everyday people, okay, that may question or have some doubts about what they're being told, but they have to follow protocol, or you will not have your job, okay. And some people will step down, and some people will continue to do what they know is not all the way right so that they can keep peace. Okay? So, okay. How can anyone not believe that increasing the number of COVID-19 deaths may create an avenue for states to receive a larger portion of federal dollars? Already, some states are complaining that they are not getting enough of the CARES Act dollars because they are having significantly more potential COVID-19 deaths. Again, in other states, we'll stick with like New York because I know that this is going on. They are being told not to spend as much time to resuscitate, not to spend that much time on CPR and things of this nature, because they have to move on. So why is it so funny that on the news and in real life you hear so many people saying that their elderly family members are maybe have a lot of underlining illnesses, especially in certain communities. Okay, and they may have not been feeling well or something, or somehow they end up in the hands of the people at the hospital. And in those cases, again, remember that certain floors, okay, of the hospitals, there's only have been closed down. Nurses have been sent home, but some of these people are flying nurses out from different states. I don't know if they're still doing this or if this was something they just did a while back. Okay. But when we look at things like this, they're closing down whole, you can't even see a regular doctor for regular things in most places. Okay. So they're closing down and using full floors and things like this in order to have a minimum amount of workers taking care of these said patients. Right. Okay. So a lot of these elderly people might be dealing with issues from their underlying illnesses, and then for some reason they're brought into the hospital and they're tested, whether they're showing symptoms or not, and then they're having it. Okay, they're being tested and tested positive. Again, no one can know this if we're not there. Okay, but then they are for some reason called, the family members are called within 24 hours to 48 hours and told that the elderly person is having problems with breathing, and now these symptoms are here. And then again, if they're being quarantined at the hospital, you cannot go up there to see, you cannot really talk directly face to face with the doctors, you cannot see the paperwork that has been filled out to see if there's some discrepancies there. So again, you have to take these people's word, right? Okay, like we talked about in the funeral video. Okay, you'll have to take these people's words, and then within 3 days of them being in the hospital, sometimes a little bit longer, okay, maybe up to 4, then they're getting the call that the person has passed away. A lot of these people on the news will tell you that they were FaceTiming and calling 24 hours, even though the hospitals are overwhelmed, right? That they were able to talk to their family member, and get a personal, nurse to get them through to talk to these people. And they've been FaceTiming and all this other stuff. But again, a lot of these people are heavily sedated. They don't know what's going on with them. They don't know what is going on, with their care at this time. They may be afraid, who knows what's going on. Again, I don't put anything past anyone. Okay. So, let's see. Okay. All right. So again, I mean, this is just, I think it's very serious for people to look into this. A lot of times I'm pretty sure people are going to get this information, and they may or may not ask, or they may receive the paperwork and the things that went on with their loved ones in these facilities or old elderly homes and things like this, and they're just taking the word for it because there's such a fear, and they think they know that this thing is out there killing people at this rate, and we really don't. There's so many things we can go in about this. It's not even funny. Okay. And why we should be questioning it. Okay. So on April 19th, he doubled down on his assertion video via video on his Facebook page. Jensen said hospital administrators might as well want to see COVID-19 attached to a discharge summary. And again, when it comes to this, I know they're saying that it's different and spreads. Anyway, like I told you, 90% of the people that are wearing masks are wearing them improperly. And so this mask means nothing. It's just about your submission to what's going on right now. They want to see how far we go with submitting. Okay. But at the same time, and they're not the proper mask in the first place, because the particles and air and things can still get underneath and through the sides of these masks, because again, these are not the masks that doctors would wear if they are dealing with the patients on this level. And they can give you the thought that we don't have enough, so don't purchase these things. But then again, you might as well not wear anything. Okay. But again, now we see that some stores, you're forced to wear these things, and so on and so forth. Okay. A lot of people are choosing not to even participate or go into these stores because of this. Okay. Again, to each his own. Okay. So, to a discharge summary or a death certificate. Why? Because if it's a straightforward garden variety pneumonia that a person is admitted to the hospital for, if they are Medicaid, typically the diagnosis related group lump sum payment would be $5,000. But if it is COVID-19 pneumonia, okay, I'm guessing they're calling it pneumonia here, okay, then it's $13,000. And if that COVID-19 pneumonia patient ends up on a ventilator, it goes up to $39,000. This is something to very much keep in mind. Jensen clarified in that video that he does not think physicians are gaming the system. Again, he didn't say that they're not. He just said he doesn't think. Again, that could be his opinion. Okay? A lot of people that are in that field would hate to go ahead and say something like that about the field. Some people tell as much truth as they're comfortable with telling, or enough truth as that they may not be harming themselves, in their particular field. Okay. Gaming the system, so much as other players. Okay. So much as other players, and the other players in the game are those that they're calling the world's best, scientists and doctors and things like this. Okay. Such as hospital administrator. And again, those people are going to be the ones that are going to be given a platform on mainstream media, because again, what they're saying goes along with what these people in these governing forces want you to believe. There might be someone that slips in there and says a little bit of truth, but then they end up saying something else that brings you back around to the fact that they're not meaning to tell or don't want to tell the full truth. But you can take what you can get from what they said. Okay. Who he said may pressure physicians. Okay. So these players, okay, remember. Such as, okay, and I hadn't read this article before. I just decided to save it up and read it with you guys. But again, such as hospital administrators. These are the people above the workers. Okay. Who he said may pressure physicians. Now this is going down the pyramid. Okay. To cite all diagnoses. Okay. And just like they're getting these mass emails and stuff at the beginning of the day to keep them up to date with what they're supposed to be doing in protocol, it's the same way that the media, everybody, it seems like they're all, on separate platforms, but they get the same orders from higher up as to what they should be saying on the news every single day. It's all a part of the play. Like I tell you guys, the world is a stage. Okay. So including probable COVID-19 on discharge papers or death certificates to get the higher Medicare allocations allowed under the Coronavirus Aid. Okay. Relief and Economic Security Act. Okay. Past practice, Jensens said, did not include probabilities. Okay. He notes that some states, including his home state of Minnesota, as well as California, list only laboratory confirmed. Okay. So even they're not even using confirmed. diagnosis. So I've heard that before, that they're not even using anything that's confirmed. They're just, if they feel like you have the symptoms, these are some of the things that can happen to you. And if there's no one there in your family that can stand for you, then it's just going to be what it's going to be. Confirmed COVID-19 diagnosis. Others, specifically New York, list all presumed cases, which is allowed under guidelines from the Center for Disease Control. And we all know that these people are not accurate with their information. They even tell you when they're giving these numbers that these may not be the actual numbers, that they may be, increased or even under what's being said. Okay? And prevention as of mid-April, okay, and which will result in a larger payout. Jansen said he thinks that overall number of COVID-19 cases have been undercounted. Okay, so wait a minute. Okay, let's finish. Based on limitations in the number of tests available. Okay, so Jansen said he thinks that overall number of COVID-19 cases have been undercounted based on limitations in the number of tests available. So this is what I mean by spilling the truth a little bit, but then also saying something that they may have been undercounted. When a lot of us that are really paying attention and really, just want the truth or something close to it. We just don't want to be led or manipulated by things that have not been that are not factual, like them just thinking someone has COVID and putting them on a ventilator, and someone who has the test. Okay, so again, in some states, just having the symptoms is a cause to say that, to confirm that these people have it. Some of these people haven't even been tested, and they've been labeled even on their death certificate. Okay, so again, this is what I mean by giving you a little bit of something and then taking it back, because a lot of us think that the number have been over rated. Okay. And the Surgeon General came out a while back and said that, and I haven't seen much of them because I don't keep up with the news like that, but I haven't heard much more about it, but to say that the numbers have been what do you call it? Not in increased, okay, or they've been the numbers are lower, okay, than we've all been told, basically. So it says provision in the Relief Act, the coronavirus relief legislation created a 20% premium or add-on for COVID-19 Medicare patients. There have been no public reports that hospitals are exaggerating, but there have been, okay? COVID-19 numbers to receive higher Medicare payments. Why would we even be talking about this? Because this is, friends, what's actually going on. Because usually they'll give you something that many people have been saying, that's the truth, that people are, starting to talk about, because they're watching everything that we say, and they're funneling it through programs with keywords and things like that to pick up what the masses are saying. And like I said, they'll use media in order to grasp you in and say, oh yeah, we are saying that too, but it's not true, this is why it's not true, blah blah blah. Okay. Numbers to receive. Of course they're not. Do you think that you're going to open up the news when they want us to be in fear and stay at home and do all these other things that are lowering our immune system and wear these masks? That is one of them, and all these other things, right? Okay. So do you think that they're going to come out on the front page of every newspaper when they're getting their orders from the people that are in bed with the people that want you to be afraid of this thing and say, guess what? Do you see what I'm saying? Okay. I'm sorry. We're the hospital that have been taking care of many people's relatives. And you know what? We're going to go ahead and admit that, we've been putting the numbers up higher so that we can get extra payments from Medicare. Like, really? Okay. So Jensen didn't explicitly make that claim. He simply suggested there is an avenue to do so. That plausible COVID-19, not just laboratory confirmed cases, can be green lighted. So given the go for Medicare payment and eligible for 20% add-on allowed under the Relief Act. Okay. All right. And I don't know what this is, but it seems like more fear mongering. Okay. Let's see real quick. Okay. No mask, no gloves, no problem as coronavirus cases soar. Carefree day trippers from Illinois pour in as Wisconsin reopens. Towns, resort town fills with people who appear to be just uh, kind of done with it all. Uh huh. Yeah, they know. Okay. Weeks at home lead people to clean up. Now donations are streaming into Goodwill. That's a plus. Mm-hmm. Which they get these donations and all kind of tax write-offs, and then they upcharge their items in the Goodwill, to people that are supposed to be going there to shop for deals. Okay. Anyhow, let's see. Uh, and they want you to fear this. Again, Georgia has been open up for weeks, and their numbers are down. Okay. They didn't go skyrocket and all these other things like they tried to make people fear and all this other stuff. Okay. The initial 30 billion out of 100 billion in the grants dedicated to healthcare providers to address the pandemic was dispersed according to 2019 Medicare reimbursements. The second wave will focus on providers in areas more heavily affected by the outbreak. And I'm guessing that this is having to do with some of that HR 6666 as well, in my eyes. Okay. They're getting ready for it with those type of bills. The second wave will focus on providers in the areas more heavily affected by the outbreak, according to Kaiser Health News, giving rise to Uh, Jensens concerns that the hospital could exploit the CDC's guidelines allowing presumed cases. Jensen did not return an email requested from USA Today for comments about his claim. USA Today reached out to Marty, a surgeon and professor of health policy and management at Johns Hopkins. I think Johns Hopkins has something to do with where the CDC and where these people are getting these numbers. They may be keeping track. I'm not sure. I can't remember. Bloomberg School of Public Health about the claim. Uh, Makari said in an email April 21st that what Jensen said sounds right to me. Makari did not elaborate, answer additional questions, or respond to a request for an interview. USA Today reached out to the American Hospital Association and Federation mm-hmm, of American Hospital on April 22nd, but as of uh, publication had not received a response. Again, all these companies that you hear nothing about until something like this happens, right? Okay. So how does Medicare pay? Snopes investigating. I don't believe shit that Snopes say. I don't even know who um, really would believe what. You see, this is just like for them to try to confirm things. Again, I don't know anybody at Snopes enough to believe and trust what the hell they tell me is real or fake. That's for me to decide. And see, that's what's wrong with Americans today. You rather let somebody like something like this that we it's really a I think I did a little bit of research on this before to find out who the owners were, but they've been under fire for things before, and they're not the say all, end all for every fucking thing, right? So, again, that's just ridiculous. I just can't. I really can't with these people here in America. Okay? Finding it's plausible Medicare pays in the range Jensen mentioned, but does not have a one size fit all payment to hospitals for COVID 19 patients. Okay. Um, oh, this is going to be too long. Wait a minute. Let me just try to get through it. I'm sorry. I didn't know it was this long. Okay. Uh, sorry. Okay, let's see. What is this? Get the facts, fact check, viral post. Fact check, no, you should not be wearing a mask, gloves in public. Oh, that's something that Fauci, which again, I don't trust anything he says either. Okay. Fact check, did Woodstock take place in the middle of a pandemic? Face masks do not weaken the immune system. Fact check. Hospitals get paid more if listed as COVID. Okay, so I don't even know if we needed to read that. I'm just trying to figure out where we were. Okay, right here. Okay. As explained by Nurse Elizabeth, each hospital has a base payment rate assigned by Medicare. It takes into account nationwide and regional trends, hmm including labor costs and very healthcare resources in each market. Then each diagnosis related group, which classifies various diagnoses into groups and subgroups, is assigned and weighed the basis. Okay, so again, you guys can read this on your own. I will try to remember to put the link for this article in the description. If not, you guys see where it is. Okay. Okay. As fact check weighs in, the figure cited by Jensens generally squared with estimate Medicare payments for COVID-19 hospitalizations based on average Medicare payments for with similar with patients with similar diagnosis. Again, whatever happened to the number of deaths that are happening with just the regular flu? Are these just the numbers? I mean, I know that, there have been the 80,000 last year, but that was the first time it was that high in 10 years, they say. But again, it was pretty much up there even before that year. I can't remember and I don't want to misquote. So, again, you can do your own research on that. Uh, So Angela, who interviewed Jensen, noted Jensen said he did not think the hospitals were intentionally misclassifying cases for financial reasons. Well, what other reasons are they? Because they've already come out and said that this is what they're doing. Okay? This is what they're doing. They've been told from higher up to put COVID on the death fucking certificate. So what do you mean? And those who watch the mainstream media and believe everything, and though, you know what I'm saying, we can't believe it just because they've said it, but it's just funny how they have said it, and then we're going to go right back to saying that this is not something that can be done when it's clearly being done. It's clearly being done. And these so-called officials that are being put in front of you, these puppets that work for the people that, again, are most of these people are cohesive with each other when it comes to the mainstream heads that we always see, right? Your favorite news broadcaster and these people like this, so at the end of the day, come on. Okay. But that's how his comments have been widely interpreted and paraded on social media, and they're using them because he does say that that's not really what he's saying, but damn it, is what you just said. Okay. So again, just like so many people have had to come back and retreat or whatnot on what they've said in news conferences and apologize or reiterate what they were actually trying to say after probably getting a spanking, behind the scenes. Okay. Conclusion: recent legislation pays hospitals higher Medicaid rates for COVID patients and treatment, but there is no evidence of fraudulent. They're going to keep on trying to reiterate this. Okay. A number of editorial boards. Okay. So, again, very unlikely that physicians or hospitals will falsify data to be motivated by money to do so, or they'll just motivated by their higher up administrators. Do you see? Okay. Our ruling true. We rate that the claims that hospitals get paid more if patients are listed as COVID-19 and on ventilators as true. Hospitals and doctors do get paid more for Medicare patients diagnosed. And notice how a lot of doctors and nurses have been sent home. So more than likely, if no one's allowed up there, you don't know who these doctors can be some kind of doctors that have been flown in from Nova fucking Scotia or something, okay? And they could be now in there handling these patients. These could be foreign entities. These could be anything could be going on. Do you see what I'm saying? Okay. Since there's limited access to those areas, okay, even by regular hospital staff. Hospitals and doctors do not get paid more for Medicare patients diagnosed with COVID-19, or if it's considered presumed they have. So even if it's considered or presumed that they have COVID, absent a laboratory confirmed test, and 3 times more if the patients are placed on a ventilator. Uh, let's see. Cover the cost of care and loss of business resulting in a shift in focus to treat COVID cases. Okay, so the higher allocation of funds has been made possible under the COVID Aid, Relief, and Economic Security Act through Medicaid or Medicare, 20% higher to its regular payment of COVID patients, as verified by USA Today through the American Hospital Association. Blah, 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 blah. Okay, so yeah, all right, so that's the gist of it. You guys can think what you want. Go ahead and leave a comment down below. If you have something to add on, I'd like to hear what you guys have to say. You can also join me on Instagram at Shay_seeking. You can join me on Facebook in the group American Aborigines Unchained if you'd like to see more alternative information like this from me and others that are in the group. And yeah, if you end up seeing this on Facebook and on my platform on Facebook, then you can go ahead and join us on YouTube at American Aborigines Unchained for more information such as this. Okay. So again, thanks a lot, and I'll see you guys soon. Take care.